Welcome everybody. We're trying a different approach for this webinar. Generally, we run one product per webinar for an hour. Lots of you are busy, and we've had lots of requests to run webinars that are a little bit longer, an hour 25 minutes. But to put multiple products in, obviously we have 3 core products at JIFJAF that are built through the MyBotGP range. So what we're going to do is we're going to do it today for the first time and essentially see how it goes. It should be fine. We're going to run through our 3 products today. We're going to start with our pathology management platform, which is used for both EMIS and System 1. We're then going to move to our document automation, which of course automates document. So for those of you that are using document, that's worth watching. And then we're going to move to our repeat prescription automation finally. So it'll be about 20-25 minutes, 20-25 minutes, 20-25 minutes. And again, if anyone drops, obviously we're going to share the recording. Now, I think having normally spending an hour on each product, we like to run quite interactive webinars. We get lots of questions and stuff. So if you do have any questions, please pop them in the chat. We welcome questions because it helps you validate how the tool will fit into your practice. So don't hold back from questions. We'll get through as many as we can. And if we run out of time for each of the individual products, we can obviously follow up with a phone call to go into more detail or another demo to finish off giving you the information. So again, we're going to run through the 3 products today. Sandra, will you let them in? Yeah, thank you.
Yep.
Thanks. So we're going to run through the 3 products today. Please pop questions in the chat, 20 minutes or 25 minutes per product. And we'll get through as much as we can. And if there's time at the end, we'll circle out. But I'm going to go through this pretty quickly. So do bear with me, and then because I want to stop and see whether you've got questions. Okay, so the first product that we're going to run through today is our automated normal pathology check file and SMS platform. This is completely unique in the market. I can tell you now there is no other tool with this capability in the market. Our tool is fully automated and it will validate all of your pathology tests based against fixed rules that your clinicians will decide upon. It's essentially here to help save clinical time and enforce rules and standardization. So you can increase safety by having a machine run additional checks on pathology tests. And obviously free clinical time as well. So this slide is on all 3 of the decks, which we're going to show you. So I'll run through it once now, and then we can skip through it the next 2 times. So we're an NHS ICT partner, which means that MyBotGP lives in NHS Cloud. So I need to unpack what that means. We are a private UK business. We are not an NHS organisation. However, we are in a fortunate position where we have a partnership, a wonderful partnership with an NHS ICT, and that means we have access to our own NHS Cloud. So all of the MyBotGP range lives in NHS Cloud, and that's important for you because it means that DTACs, DPIAs, data sharing agreements are not an issue for us. Also, MyBotGP, obviously it's fully secure and locked down within the NHS cloud and virtual hosted infrastructure, can be installed and plugged in super quickly. There's no long configuration stages, and obviously it adds a nice bit of credibility as well. We completed a Health Innovation Launchpad program several years ago, which is NHS and government funded for helping innovative companies launch products in tech. And we are now in a fortunate position where we're supporting hundreds of practices, PCNs and federations across the country. This tool is, our tooling is being used at scale in the UK. Our normal pathology management platform is classed as a medical device. And we also have a DCB 0129 certification, which is an NHS clinical risk certification, DTACs, DPIAs, and obviously it works with both EMIS and System 1. We have practice and PCN solutions. If you buy this at practice level, it can be bespoke to practice level. If you buy this at PCN level, as we're starting to see lots of PCNs buy kit in the last sort of 6 months or so, it seems to be more a thing that PCNs are doing. Then each practice, if they want to, will still have their own copy and can bespoke the rules as they wish. We've seen that's important because different clinicians, especially for the pathology management tool, will have different approaches to looking after their pathology tests, and obviously they want their rules to be used. Well, you can do that. No one is going to tell you what rules to use in order to validate your pathology test. This tool is a purpose-built platform that can be configured by you, so your logic will be replicated. And the principle behind our tooling is essentially reduce practice costs, improve safety, and help you do more with less. This slide is on the 3 decks as well, so I'll just run through this one really quickly. It's just about time. People are not good, or we are not good at reconciling how long things take. 15 minutes a day doesn't feel like much. It's only 15 minutes. But actually the reality is 15 minutes every single day works out at 91.25 hours over a year for one person, unbelievably. And based on a 40-hour working week, and lots of people work, and that's including breaks and lunches, that's well over 2 weeks for one person. So if we can give you back 15 minutes a day, we're giving you 2 weeks for one person. 30 minutes a day, we give you back 4.5 weeks for one person. Obviously, pathology management out of practice is managed by multiple clinicians. So this is a scenario whereby if you have 5 clinicians at a practice, we can give each clinician back almost 30 minutes, every single one, every single day through using this tool. Same principle for Document and the same principle for repeats, although Document obviously is more of an administrative support tool. This is a clinical support tool. So the business case for this slide example that we use is a practice with a list of 8,500 patients. So a list with 8,500 patients will have approximately 5 partners, and they will receive approximately 200 pathology tests every day. So unbelievably, that's 62,400 pathology tests on average will pass through that 8,500 practice. Now, if you're double the size, you'll get double the amount of tests, and if you're half the size, you'll get half the amount of tests. But then, of course, the amount of partners will change as well. So the volume of work doesn't change if you're half the size or double the size. You just got more partners doing the same work. Now, all of these pathology tests, pathology is the biggest workflow in primary care. It's used for everything. All of these pathology tests must be manually checked. Every clinician spends up to 30 minutes a day just validating normals and running additional checks on normals to make sure that they don't need to do extra exploratory work on patients before moving to the abnormals. So all path tests sit in 3 buckets. Normal, no action is bucket 1. Bucket 2 is normal, but might need action because you need to check the patient history or pathology test report for health condition or medication, or abnormal. So what we're saying is that a path test can come back from a lab and be normal, and your doctors will know in advance that whenever we see that path test and it's normal, we don't even need to see it, it can be filed. However, there'll be a load of hundreds of other pathology tests that even if they come back as from the lab as normal, they need to double check the patient history to confirm if they're on medication or have a health condition, or if there's been a percentage increase or decrease, to then say, okay, yeah, I can dismiss that path test, or no, that needs to be flagged because I need to continue my investigatory work on that patient, because despite that path test coming back as normal, it's been affected by either their health in one way or another. And MyBotGP will do that for you. And then abnormals. So think of MyBotGP as a massive safety net at the front of the practice. A safety net in terms of not letting any path test slip through the net, and in terms of freeing time of clients, of practices, and all. Oh, sorry, can you go on mute? Sanj, can you mute everyone?
Yeah, sure.
Okay, fine, thank you. Okay, can you hear me? Okay, yeah. So think of MyBotGP. So essentially, you're ensuring all addition. So it will sit at the front of the practice. All pathology tests will pass through the platform, and it's going to ensure that every single pathology test is checked in terms of, is it validated that that path test is normal, or do you need to run additional checks on that path test to determine whether the doctors need to see it? And if they don't, it will be filed, and if they do, it will be flagged. So you're improving safety, freeing masses of clinical time, In addition to that, you're providing standardization and enforced rules at practice level. That's really important to lots of our clients because they say different people manage path tests in different ways, and they want to set an enforced, standardized approach to doing that when they're away or on holiday or different people covering work. The time savings are astronomical. Every patient, if you base this on every partner spending up to 30 minutes a day on this task based on an 8,500 list and 5 partners, that works out 12 hours a week, which is 1.5 days of clinical time, which at practice level is 19 days a year across 5 partners and 95 practice days of clinical time at an approximate practice cost of £50,000. So you're freeing up 95 days of clinical time, adding additional rules, and saving money. This is a massively popular tool. So the rules, and again, we're going to go really quick because we've got 3 products to run through today. The rules are here. MyBotGP works 7 days a week. We're now looking after 200 different pathology test types. There's 200 different path tests running through our platform, and our clients combine any of the following rules to validate pathology test results and what they mean for the patients, then file or flag. So to begin with, do they agree with the lab? Pretty straightforward. If they disagree with the lab, would you like to supersede some of the lab ranges? Well, you can do that with MyBotGP, and lots of our clients do supersede some lab ranges where there's some subtests are slightly out. They don't class that as a fail, or they want to put new ranges for prostate or EGFR or so on and so forth. Now, MyBotGP can pick up a lab test. It can read it. It can then be told, go back in the patient history, check to see if the patient has had a previous test. And has it gone up by a certain percentage or gone down by a certain percentage? And you can tell MyBotGP that if it fails that test, fail it, because the doctor wants to know that it failed that path test despite the lab saying it's normal, and they need to see the patient. It can also go into the patient history, and it can check for medication, health conditions in the patient record, and it can also read the pathology test report to check for warnings or messages on the pathology test report. Obviously, lots of path tests don't have ranges. They might use words, detected, not detected, found, not found, positive, negative. So there are hundreds of tests a year that will come through where it will read the path test report. And often there are warnings on path tests as well. You can separate off in terms of age and gender, so you can really narrow down the logic to validate whether, based on someone's age and gender, despite that coming through as a normal, do you need to see that patient or don't you? And obviously you can omit patients. And then what's really interesting from an audit, interesting to people who do audits and valid to people who do audits, is because it uses System 1 and EMIS, you still have visibility of all of the tests in System 1 and EMIS. Nothing is going to disappear. In fact, we add an extra reconciliation point in terms of in MyBotGP, where we'll send you a report every day of what MyBotGP's done, and there's a full audit log in the application itself. So you've still got your full audit in EMIS and System 1, and there's a second audit that we provide you as well. So this is how the tool is configured. I'm going to do this really fast, and then I'm going to show you some examples, and we'll move to the next tool, and we'll stop and see if there are any questions. So let's say, for example, this is a liver function test that's come through from your lab. These are the ranges from your lab. Your partners will look at this, and the clinicians on here will look at this, and the first thing that you'll say is, do you agree with that or don't you agree with that? So what that means is, if you're happy to not run any additional checks on this normal from the lab, if it sits within these ranges, and just file it, you would click this box here, file for normal report. And then the next time MyBotGP sees this, it's going to file it, and you won't have to see it. If any one of those fails, is out of range, it will fail it. Now, let's say you don't agree with the lab, or you do, but you want to add additional checks. So you can simply click on any of these boxes and adjust the ranges. So prostate, I'll come back to the prostate example in a minute. So prostate is an example where they supersede the ranges. Or you could say, check against the previous test result. You just click yes on here, and you put the percentage increase or decrease. Or here you tell it what keywords to look for in the patient record. Keyword check, absent, present in the problem page. And then you've got your filing strings, your comments and filing strings. So if you bring it back to the rules here, the example that we like to give is prostate is one, which uses all of these. test, all of these results just on one test. The majority of our clients supersede their lab ranges for prostate. They put 5 ages and 5 ranges because not all labs are doing that now. So they put an additional check in there saying, even if it passes the age and range superseded lab, I also want you to check in the patient history and see if the patient has had prostate cancer or metastatic cancer. And if they have, I want you to fail it because I still want to see that test. Other clients for prostate, not so much now, but they did a few years ago, would agree with the lab range, which generally gave 1 range then. A fail was a fail. However, anything that was a pass, they wanted it to go back in the patient history and check to see if the patient has had a test before. If they have, has it gone up by more than 5%, 0.5%, or whatever the figure is? And then flag it if it has, because they were looking for the percentage increase. HbA1c, most of our clients say check to see whether it's had patients had diabetes or pre-diabetes, fail it if they do. EGFR or some other tests, we've got clients that start 60, some start 90, some look for medication, others don't look for medication. You can really bespoke this as much as you like. So before we move on to the next tool, which we'll stop for questions first, obviously, this is an example of 181 different pathology tests that our clients across the country are running through the platform. Again, we're up to 200. This is an indicative snapshot. So again, these might not be the way you would do it, but that's fine. You can bespoke it. It's just as an example. Here, and we share these with our clients. What you're looking at here, path test name, subtest name, gender, age, check for normals, ranges, check against the previous test result, keyword checks, filing strings, comments and filing strings. So essentially what that is this here. It's a printout from practice level here. That's these rules. So this is printed out from a practice. Okay, agree with the lab, supersede the lab, compare tests, patient history, path report, read those, age, gender. So the first example here, again, this isn't a test you'll be requesting thousands of a year, but it's a good example just as a first one. And we'll show you others as well. This particular client has set the tool up for a 24-hour sodium test, subtest 24-hour urine sodium. They're not fussed about gender, they're not fussed about age. They're not interested in checking against the previous test result. They want to use the minimum and maximum values of 27 and 287, which I think are lab standard ranges. So they're happy to file based patient passes that. However, in addition, if you look in the top left-hand corner here, where it's the keyword check, they want MyBotGP to do an additional check in the problem page to check whether the patient's had diabetes or chronic kidney disease. And if they have, they want it failed. So they've told MyBotGP, I'm happy with you to file based as a normal on these lab ranges. But before you do that, go and have a look in the patient record. And if you spot this, I don't want you to file it because I want to know about that particular test. Prostate is the example that we gave before. Let me just spell that correctly. Here we go. What you can see here is the client set this up, and most do this now, similar ranges. They put 5 age ranges here. So they're superseding their lab. Here are the ranges that they've decided to supersede the lab with. However, before filing, I want to have a look in the patient record and double check patient hasn't had prostate cancer or metastatic prostate cancer, because obviously they shouldn't, even if they come in at that range, that shouldn't be there. So the keywords, as you can see here, AKI, CKD, cancer, diabetes, pre-diabetes, pituitary, they're used all the way through hundreds of tests in order to make sure that you enforce the additional checks on the patient record, on the patient before moving to the next one. I talk too long, I start coughing, so I'll apologise now. HbA1c, again, here, standardised 20 to 41. However, they want it to read the path report. It says diabetes or pre-diabetes, fail it. Okay, so I'm going through these super quickly. Hopefully you will have been shared a copy of this path test list as an example before, when you register for the webinar. We're more than happy to share it if you haven't had it and book a call to talk through in more detail. You see hundreds of pathology tests. So the time saving from this tool is validated. It's robust, it's secure. It runs 7 days a week in the background, and it will make sure that nothing slips through the net. The way that we price, unlimited path tests, unlimited volumes, very straightforward calculation. This looks super complex, but it isn't. There's a cost for NHS Cloud. Obviously, all of our kit lives in NHS Cloud. We separate that off, but based on a list of 8,500 patients, the cost is 3,887 plus VAT. Unlimited path tests, unlimited volumes. And then if you take a second product, there's a discount on the second product. Again, we have PCN and practice packages. PCN packages, we give you an account manager. They will support you in adoption rate throughout the PCN, getting everything up and running as quickly as possible. So that was super quick. So I'm going to stop now before we move to the next product and ask if we have any questions. So I can't see the chat, so I'm going to stop sharing. Well, actually, I'll leave it sharing. Sanj, can you see the chat? Are there any questions?
Yeah, there's no questions as of yet.
Okay, so let's wait a second. Please pop question. If you have any questions, please pop them in.
Oh, a question just came in. Do prices include VAT?
Plus VAT. So those figures are plus VAT. Any other questions?
Just waiting. Please pop your questions in.
We welcome questions. Please, if you've got anything that's in your mind, just
how often. So next questions come in. How often is the cost applied?
So it's an annual subscription. An annual subscription, unlimited path tests, and unlimited volumes. Any other questions to go?
Yeah, I can see Claire has got her hand up. Claire Higdon from University Hospitals Plymouth.
Yeah, I'm actually from the Pathology Network in Devon and Cornwall. I'm just hosted by UHP. The reason I'm talking is because I can't post in the chat, so I don't know if there are other people like me who can't post in the chat. But my question is, how many other practices or PCNs are currently using this solution?
So we've probably got 150, 200 practices using the solution at the moment, give or take.
Thank you.
Okay. And any other questions? And thanks for joining, by the way.
We've just got another one. Thank you very much. Would you email, they're flying in now, the questions. Thank you very much. Would you email a copy of the presentation? Yes, we will. Does the cross-check, example, looking for pre-existing conditions rely on read codes?
Sanj, do you want to answer that one?
No, so it doesn't rely on read codes. So essentially you would put in a word or a collection of words, and then it would look within the problem page. And based on the checks, it would then say, in or out, essentially based on your rules, but it applies against the problem page on a collection of keywords.
Thank you.
Just confirming again, you have all of the shared care agreements in place with ICBs.
Yeah, well, yes, we've got clearances at multiple ICBs across the country. All of our kit lives in NHS Cloud. If there is an ICB that we need to go through, we can share DPIA's data sharing agreements, but they're not an issue. They are essentially NHS Cloud hosted. This tool is classed as a medical device, class 1. We have a DCB 0129 certification, which is an NHS pre-mandated clinical risk certification. We've also taken the time to complete a DCB 160, a template, and we're happy to share that as well with clients. And that is around how you would use a tool like this. Some clients prefer to build their own DCB 160s, others use our template and then tweak it. And just to add, with this tool, this is all based on, obviously, practice level. You are receiving pathology tests at practice level, and it's decisions around what you want to do with those path tests in terms of additional actions for the patient or not. We are starting to do some interesting stuff now in terms of interoperability, neighborhoods, all of that type of stuff, because it can be delivered at scale. If you wanted to standardize across a PCN or a neighborhood team, whenever that comes into fruition, that's possible. I'd like to see that possible, because most practices will want to set their own rules. But that capability is there, or you can continue to bespoke it yourself at practice level. So we've got about 1 minute left or 2 minutes left before we jump into document.
Just a couple of more questions, James. So if the lab changes the values and if MyBotGP is set up to accept lab values, does it automatically update it without any delay?
Good question. Yeah, let's Sanj, you can answer that.
I'll take that. So the way it works is we record the lab ranges. It gives you notification of the lab ranges. There are then you're then able to supersede the lab ranges. So essentially, you've got almost 4 columns. The first 2 columns are lab range min max, and then the other 2 columns are clinician ranges min max. And essentially, so if a lab range changes, it notifies you, but then, and I say, then you will then make that decision whether you want to change it, keep it the same, entirely up to you. So no, we're not allowed from a compliance perspective to actually change any labs. They're ultimately up to the clinician to do that. However, we give you a warning within the platform saying, hey, this pathology category has changed. What do you want to do?
And thanks, Sanj, and just to add in that, and whilst that path test is in limbo, so to speak, it won't be actioned. So it will spot the new range and skip it. Okay. So any other questions?
How much does the cloud cost?
Depends on the list size. Hello.
Sorry, I thought you were at home today.
I am not supposed to be working, but I'm listening to a webinar for digital stuff.
I've just muted them, I think, accidentally. I've just How much does the cloud cost, please, James?
Okay, so it's based on the size of the practice, of the size of the list, but essentially it's based in buckets. So 10,000 patients, 7 pence, 10 to 15,000, 6 pence, 15,000 up, and 5 pence. Well, we can send quotes and afters, but the basic calculation that we give, which scales up or down, give or take, is the 8,500 list comes in at about 3,887 plus VAT. Good. So,
Okay.
sort of said at the beginning. So, yeah, sorry, Sanj, go on.
There was one final question, but you can either park it or.
Yeah, go
on. So, can you describe the nature of your S1 integration? Is it using NHS digital IM1 route in real time or near real time, or a different approach? Is there a delay communicating with S1?
Okay. Yeah, I mean, we can answer that. This is an overlay system. Our tool operates fully independently, and there's no delay. It's a completely different configuration. So MyBotGP is an automated platform that we use System 1 as a user, just like you would. So it doesn't need the IM1 integration. Good. Now, apologies to anyone. I know we're going through this quite quickly, but this is an experiment to run through 3 products today. So if I don't stick to the timings, I will get into trouble. So, and again, any other questions that you've got on this particular product, we can set up calls. We'll share the information afterwards. We'll share the decks again. We'll share the spreadsheets and a copy of the webinar as well. So our next product here is, we're going to go through now, if I can find it here, is our document automation product. Okay, so the first couple of slides you would have seen before. So we don't need to spend time on those, but essentially for the couple of people that just joined, this product is also delivered from NHS Cloud, so locked down and secure. This has a DCPO 129 certification. We've built out a DTAC for those of you that would like to use it, and the same principle in terms of here to reduce practice costs, improve safety, and help you do more with less. Time saving for this is an administrative time saving rather than a clinical time saving. Letter management takes a lot longer than 60 minutes a day, and there's definitely more than one person involved. Same principle as pathology management. 15 minutes a day is 91.25 hours a year. 60 minutes a day is 365 hours a year for one person. So I want to start. We like to describe this tool in sort of the other way around, so what it doesn't do to then tell you what it does do, because what we've seen out there is there's lots of different tools offering lots of different things, and lots of different pricing, which is bizarre. We've seen some really expensive tooling, thousands and thousands a month, with limited letter functions out there, and we don't quite understand how that makes business sense. But so what I'm going to tell you what this doesn't do, and then what it does do. So this tool is very competitively priced. It's very similar to PATH. It's just it's unlimited letters and unlimited volumes. There's a configuration cost. So that 8,500 list comes in at 5,137 for unlimited letters and volumes. This tool is not here to make medical decisions based on reading letters. Okay, just to put that out there to begin with. So if you want a tool that's going to pick up a letter, validate a letter, file it against the patient record, read it, clinically code it, prescribe medication, work out calculations, do all that type of stuff, this isn't a tool for you. But in reality, there is no tool that can do that other than a human, basically. There are tools out there that will hazard a guess. They will read a letter and say, I think this is this. What do you think? But the reason they ask what do you think is they're not sure and they're not prepared to actually make the decision. Because if they get it wrong, obviously that's going to be a massive issue. So, and they charge 5 to 10 times the cost of what this tool costs. And we can't see any value in that. What we would rather do is add some proper AI to this in 4 or 5 years when something can make a decision and can actually press enter and do it all without you looking at. So the business case behind this tool, and again, why it's so popular, is this 8,500 practice list gets about 125 letters a year, which is a staggering 39,000 letters every single year. Massively important work, very time consuming and potentially and error prone. Those 39,000 letters a year, to start with, all need to be got onto the system. They all need to be filed. Document template needs to be completed. Letter type needs to be coded. And before anything can happen, our tool will do all of that in the background. So you don't have to do that anymore. Every single letter will be picked up, filed, and letter type coded and added to the system. No one needs to lift a finger. And that's phase 1. Phase 2 is some letters need to be clinically coded, i.e. they need to go and see a human being who can make a decision and action that decision. And others need to be seen by specific people or teams. And then there are thousands of letters a year that you don't need to see. You know you don't need to see them before you've seen them, DNAs, 111s, unless obviously there's a warning on one of those letters, and then you would need to see it, and then MyBotGP can action that as well. So the principle behind this tool is to get these 39,000 letters a year on the system for you, validated, filed against the patient record, get rid of all the ones that you don't need to see, so you don't see them, so you're not seeing them anymore, and get the remaining ones to the people that do need to see them. So whoever is doing your clinical coding, which is highly skilled work, is not having their time wasted by seeing thousands and thousands of letters a year that, quite frankly, they don't need to see because it's beneath what they should be doing. Current time estimation is about 203 days a year based on an 8,500 list. Think about MyBotGP as an automated document super user. So essentially what it's going to do, this is the document template, MyBotGP will use document for you, so you don't have to use it anymore. It's going to grab all of your letters and emails. You can email letters to it as well. It's going to pick them all up. It's going to recognize all of the letters, and then it's going to complete the document template for you by itself. Okay, you won't need to do anything. It will know whether it should be taking a date from the middle of the page or the top of the page or a name at the bottom of the page, top of the page, because obviously all letters are structured in different ways. That's not a problem. We will teach it to recognize the different letters. It's going to complete the document template. Departments, it will letter code the type as well. It can recognize between NHS and private letters. Lots of our clients are struggling to cope with lots of the wait referral letters that are coming through privately at the moment, so our tool can manage those as well. And it's going to work 7 days a week, 365 days a year. So you will have a remote worker, someone that actually likes letters, in the background, logging into document securely, validating all of your letters, completing the document template for all of your letters, filing all of the letters as well for you, 7 days a week, 365 days a year. Now, once it's done that, all practices have different letter management flows that are actioned through document. And MyBotGP will do what you need it to with each letter, leveraging all of the document functionality. So basically, it's up to you. What we're saying is phase 1 is to get all the letters onto the system. Phase 2 is where do you want them? Now, depending on how you're set up, you might want everything going to the coding team. You might want to triage to usual GP unless they're away. You might want to push some through templates. You might want to put all safeguarding letters into a particular folder. You're going to want to hide letters, set tasks. All of that functionality is there, which is the, what next thing. So phase 1 is it will recognize it. Phase 2 is you will tell MyBotGP where you want those letters, and it will do that for you by itself. Now, in addition to that, obviously, there are thousands of letters that you don't need to see a year. Pharmacy letters can be triaged off, or they can be put in a folder, and the pharmacy team go from there, obviously after being filed and coded against the system. 111s, DNAs, unless there's a warning on one of those letters, I don't know, like a DNA for someone that's under 18, for argument's sake, or 111 that says attempted suicide. MyBotGP can pick up the words on that letter, and then it will put it somewhere else if you want it somewhere else. So in the background, 39,000 letters a year based on this 8,500 list, picked up, validated. Document template will be completed, filed against the patient record, and then it's a question of where do you want those letters, and MyBotGP will send them wherever you want. So what you're left with are the letters that you need to see, that you need a human to see, that can make a decision, adding specific clinical coding or making decisions as to what to do next. And that's the principle behind our tool. Very comprehensive audit log, goes without saying, date, documents, granular breakdown. Pricing is done like this. We touched on this at the beginning. Unlimited letters and volumes. 199 list times 30 pence, and then NHS Cloud, depending on the volume of patients that you have. Estimated calculation for a list of 8,500 patients is 5137. And there are discounts on second products. And that's an annual subscription, unlimited letters, unlimited volumes. We will teach MyBotGP to recognize the letters for you, and then we book meetings with you, and then you will tell us where you want the letters, and we will send them to those places for you. So, quick skim over before we stop for questions. We'll go into here. 39,000 letters a year are received by a list with 8,500 patients approximately, which unbelievably is 125 letters a day. Very time consuming, error prone. MyBotGP is a standardized approach that's going to basically get those 39,000 letters a year onto the system for you, filed and coded, letter type coded. It's going to get rid of the ones that you don't need to see, so you don't need to see them anymore. And it will triage the letters that you do need to see to the appropriate people. 7 days a week, 365 days a year, so you don't need to worry about people being sick, people being away, backlogs, enforcing rules. You'll have something in the background running all the time. It will complete the template for you. It can pick up all letters and emails, so you can forward everything by email. It can recognize private letters. Here you could say you can enforce rules like visible to patient, not visible to patient, so you know that nothing slips through the net, and it will just run in the background. And then in addition to that, we've seen that our clients have all got different approaches as to what they want done with the letters once they've been put onto the system, so we can accommodate those. I was on a call this morning where a particular client wanted special folders for under 18s, safeguarding, others don't, others want everything in one folder. But essentially, if you like using templates and you want to continue pushing everything through templates, you can. Or you want to push to folders, you can. You want to triage to usual GPs, you can. You can use any combination of, because it's basically using Docman for you. And the value in this tool is to make sure that your skilled people who are capable of making decisions around letters are just looking at letters that they need to, and they're not spending their time cutting and pasting and double checking the dates are correct in the Docman template, which is a massive waste of time. So let's stop for questions now. Sanj, any questions in the chat?
Hey James, I'm just replying to one. Just give me 1 second. That's done. No, there were a couple on path, and I've just finished replying to them, but nothing as of yet. So again, just if we can request everyone to pop in their questions for Docman, please. I was just beavering away replying to a few of the questions on the chat. again, it is again. We've got another path one, but that's is this for EMIS and System 1? I assume.
This
Yeah.
Sorry, does that question relate to path or Docman?
I assume it's the Docman one.
Okay, so the Docman, you must be using Docman for this tool to work. We are working on a System 1 attaching docs. We're calling it Letter, which will be an equivalent to this, and that should be ready early next year.
Just a question's coming. Can you have MyBotGP Docman standalone from example pathology?
Yeah, you can buy them individually. Yes, 100%. The tools can be bought on their own or together. Think of MyBotGP as different people that automated people, automated robots that you're requiring to do different tasks. So yeah, you could have Docman and Path, or just Docman or just Path.
Okay, lovely. Another question. Where can you forward emails to it? How well does it pick up emails that may have information in the body of the email as well as attachments as well? So should I?
Yeah, you want to take that one?
So 100%. So basically, MyBotGP will pick anything and everything from your not in folder. So what you need to do is get those emails forwarded to your not in folder, and then essentially it will pick up at the body of the email and or attachments, because basically it's all about the training. We will train those letter templates and tell it where to pick up the information. And then it will file it accordingly based on how it's been trained, i.e. what department, what clinical department, organization, event dates, all of the normal kind of stuff that you apply when filing. But just to answer, it only picks it up from your not in folder. That's its primary source of where it extracts and files documents.
Thanks, Edge. Does that answer the question, or any other questions?
I think so. Yeah.
Yeah, let's wait one more minute in case someone's...
Sure. Again, if we can just please pop in your questions.
Okay, good stuff. So let's move on to the next. Sanj, if anyone pops in, let me know.
Yeah, I'll reply. Yeah, no problem.
And again, as before, we're going to forward these decks. So anyone's got any questions, please jump in. And if you want any additional meetings, then we can do those as well. Okay, so our third and final tool is our repeat prescription automation. Again, same principle as before. This tool has DCB 0129 delivered from cloud, NHS Cloud, so all locked down and secure. In answer to the questions before, time-saving slide we've done before. So if you think of it this way, an average list receives between an 8,500 list, unbelievably, receives 225 to 325 repeat requests every single day. 118,625 repeat requests a year. And again, this is a coincidence that this figure ends up at the same amount. And you have clinicians in a lot of cases who are doing very basic checks in advance of authorizing whether that prescription can be authorized or not, which essentially can be handed over to an automation tool, so the clinicians can focus on the more complex stuff, the stuff that they should be focusing on, not whether someone's asked a week early, which is essentially what this tooling will support. So MyBotGP will pick up any repeat requests within EMIS. Okay, so it's not going to pick up emails. We are working on that at the moment, but it will pick up anything that's within EMIS. And it's going to run through some guardrails to determine whether that repeat prescription request can be forwarded to the next stage. And then it will run another guardrail check. And if it passes that, it will be forwarded to the next stage for sign-off. If it fails any of those checks, it's going to fail it and create a task at reception. So reception are aware that someone has attempted to request a repeat prescription and they weren't allowed to have it, so it's been blocked. And then some of our clients contact patients, other of our clients don't. That's completely up to you. So this tool in principle, whilst extremely complex to build, it's quite simple to explain. It's just around guardrails. So if you think about it, someone requests a repeat prescription. There's some quite straightforward logic. Firstly, are they allowed it? in terms of is this person on an ongoing repeat? Have they had a medication review? Is it a 6 month? Have they been prescribed it for 3 months or 6 months? So let's say, for example, someone's prescribed something for 3 months, they've had 3 months worth, and they are trying to get another one, month 4. Well, it's going to fail. If they've been prescribed 3 months and they're in month 2, yeah, it will go to the next stage. The next check is, what's the cycle? Different practices will authorize repeats at different timings. Are you happy to authorize after 21 days or 26 days or 28 days, whatever your repeat cycle is, to ensure that a patient doesn't get all of their 3 repeats in that scenario in 1 month? So you can set up that guardrail. If it's within the guardrail, it will pass it forwards. If it's outside of it, it will fail it. So what happens is anything that is successful will have passed through the initial checks and will end up in a folder for your clinicians to open up and sign off, because they know that those checks have been done already or passed to bulk signing or whatever. In addition to that, you can tell it to keep an eye out for controlled medication, prohibited medications. Perhaps you always would like to see those, when people request those, or there could be a removed medication that someone could be on. You can pop that name in it, something that's no longer being prescribed, and it could flag that as well. So it's all about guardrails and essentially reducing the volume of path tests that you need to look at and doing those checks for you. Regime dates, review dates, tolerances, skip to next patient, prohibited drugs. And it does that through logging into the EMIS medication management page, patient service request, reviews each repeat prescription request, and validates against the guardrails, passes to the next stage. If it passes the guardrail, regime, prohibited check, it ends up in a folder for your clinicians to sign off. If it doesn't, if it fails any of those, it's going to get rejected and a task will be created at reception. So really easy one to describe. This tool is very, very straightforward in its logic. Set regime dates, exclude particular drugs, prohibited drugs, set issue date tolerances, minimum number of days since the last drug issue date, and so on and so forth. Very comprehensive audit log, as there is with all of our tooling, with the pathology management platform, the document management platform, and the repeat requests. You'll be emailed every night a list of what it's done. There's also a more comprehensive audit log within the application as well. The way that we train, we go on to pricing, but the way that we train, we have weekly client training webinars. They're open invites. Most clients come to a couple. You only need to come to a couple. And then if you've got a question or need some support in some area, just log in. Sometimes we have a couple of practices on there. Sometimes we have 20, 30 practices on there. We'll run them whether we've got 1 practice or 20. And then we post all of our client training onto a private YouTube channel. So it's pretty straightforward to use. Pricing is the same as pathology. Again, there's discounts if you take more than 1 product. But all of our kit is based on unlimited requests and volumes. 749 list times 30 pence plus NHS Cloud based on how many patients you have. But the example calculation that we generally work from with an 8,500 list is 3,887 plus VAT. And then if you took pathology management as well, this is reduced to 499 for Docman. This obviously Docman's priced slightly differently, but there's about a £250. And then probably another £150 off of NHS Cloud cost as well. So, any questions? Sanj, anything in the chat?
Not yet. So just replying back to a few questions there, but nothing new.
Any questions to share in the webinar? Or?
No, nothing on repeats. The last one was for Docman, but nothing new at the moment.
Just hang on a second.
Mm-hmm.
Okay, good. So if there's no other questions, what we can do now, we can circle back to the beginning and say, right, so I think what I was hoping to do is to run through questions on the 3 products now, so we can talk about them together as a group. Does anyone have any questions on any of the products that haven't been answered yet? So we have the pathology management platform, we have the document automation tooling, and obviously we have our repeat prescription tooling as well. So if we go into the chat, so I'm just looking at the questions that were asked in the chat: lab range changes, cloud, the system 1. There's some other questions here. Should we read out the questions that have been asked so far for the group, Sanj, and then we can see if there's any other questions? So I think this is the one that I didn't see. So if the responsible, this is a document question. If the responsible, I'm looking here, just in terms of safety, if the responsible clinician is away on annual leave, who will notify the practice or PCN to look into the results when the lab changes? Did everyone? Yeah, but has everyone been watching the chat as well?
Well, I've pop in replies to most of the questions there just to close the loop.
Medical device.
So yeah, I mean, as there's protocols obviously to check, you know, what's happened, any lab range changes and so forth.
Okay. Do you have videos of document in use? Yes, we can share videos with you, but essentially what you're going to see is a letter being filed by Ghost, because it looks like a Ghost is doing it as the tooling is running it by itself. Trying to see
a couple of new questions came in, James.
Okay, do you want to pull those up?
Yeah. So did you mention that the prescription bot only works with EMIS and for requests originating within the NHS app?
Yes. Yes, that's right. Yeah. So the request has to be within the app. Within EMIS, it will pick it up from within EMIS.
The second one is related to the pathology filing.
Could you run that again? Explain that a bit more, please, Nazir.
Yeah, I think so. If we can get a bit more context. His hand up, maybe better just to come off me.
Yeah. Okay.
Hello, hi,
Hi.
James and Sanjeev.
Hey.
I think just in terms of the safety question, that was relating to the pathology filing thing. My only concern is if, let's say, if I take up the role of, you know, being in charge of setting the values and everything, and if I'm away on annual leave and things like that, and the lab notifies the practice and the other partners just shy away from changing the values or anything because I'm responsible for that. And in that interim, the lab changes the reagents, the results automatically get filed wrongly. Where would that lead us, and what is a safeguard in that scenario, if you see what I mean?
Yeah. Sanj, do you want to answer that one, or shall I?
Yeah, I mean, so again, the platform notifies you. So I get that. So you get notification in the platform. You can also have it whereby if the lab ranges do change, it will then disable that pathology category as well. So there are settings within the platform to do that, to apply further guardrails. So again, I think that should answer to your question with respect to if one is away and no one's managing it. But on the flip side, when you're away, I would expect someone to be managing your pathology filing, because again, you wouldn't have anyone not manage your pathology filing and check results and just do your standard protocol checks anyway. So sort of both sides of the coin. The platform is flexible to allow for both eventualities. It's also reliant on you applying sort of your own protocols, your DCPO 129s, checking results, making sure that you're happy and stuff, and it's in line with what the rules are. But very much so, you can set the platform to do that.
Yeah.
So would the lab be responsible for notifying or
No,
because it does happen sometimes. What I'm saying is, because, for instance, in terms of if you talk about CRPs, for instance, or any abnormal results which is really out of the range or anything, the lab are supposed to notify ourselves. They ring the surgery, but it does happen every now and then. Some results we see after the weekend which should have been phoned away straight away to ourselves, really. So these sort of things, and that is what my thing is. if it's just about responsibility, who's going to be, because if that, imagine if it's something relating to a cancer pathology or something, and if that gets filed normal, and if it stays there without we realizing, and by the time we correct it, that just sits in there, and 6 months down the line we realize that is an abnormal result, and the patient puts a complaint against ourselves, and we can't, it doesn't look nice to say, oh, the system automatically does that. We are not responsible, nobody picking up the hand and saying it's my fault kind of thing.
100%. Sanj, can I jump in? Can I answer that one? Yeah. So essentially, the way that it works is and we actually added this functionality in for exactly the reason that you've mentioned. So when this tool was first launched, it was on the practices to be aware, to see whether labs have changed ranges, because obviously the labs are supposed to inform you if a path test has changed. And we run regular feedback groups with our clients, and they share sort of ideas and stuff for patch updates to the tooling. And this popped up from several sites. And so we added the functionality in whereby now, if a lab changes a range and maybe they've notified someone at the practice, but that hasn't been shared across the practice, or for whatever reason the practice hasn't been notified, and that lab range changes, MyBotGP will see that lab range has changed, and it will skip that test. So it will stop filing, it will stop applying your logic rules to that test. So that will go into a folder where you'll continue to do that manually.
Yeah, no, that definitely answers my questions. Thanks very much for that.
No, pleasure. No, I understood where you were going at the beginning. Yeah, 100%. In addition to that, just covering off what Sanj was touching on, we've built out a template DCB 160 for all of our products. And in the 160, it's a combination of approach to using an automation tool at practice level, and it covers stuff like, of course, you're going to have a master user. But you need a secondary user as well. So for scenarios whereby you're away, for example, who is responsible for the tool? Can they make changes? Can't they make changes? If they make a change, what's the protocol? Who do they tell? Because obviously you don't want to give out a lockdown use. Not that you would, but you wouldn't give out a lockdown username and password to 5 people and they all just keep changing the ranges without other people knowing. So, you would have one master user setting the rules. Of course, you would have a conversation at practice level if that's required to decide upon what filtering rules you want, and then you would set MyBotGP up there as well, and then we would give you the ability to have a second user, and then in your DCB 160 at practice level, you'll agree when that second user can log into the tool to make changes, essentially. And one could be a lab has changed a range, and MyBotGP is now skipping that. And then that person can make a decision: do I just wait for you to come back from holiday to update it, and we'll just look at that path test manually, or are you happy at practice for that second person to adjust the filtering rules to accommodate the new lab range for you?
Brilliant. No, thanks very much. Thank you.
Our pleasure. Any other questions from anyone across any of the products? Please feel free to pop them in the chat there. I know I said it a couple of times, but this is such specialized stuff that we find that if you don't ask the questions, you don't know. We need you need to ask the questions to validate how, just as Dr. has just now, how this will actually work in reality at practice level. Okay, so it doesn't look like there's any more questions. If there is, please pop it in the chat. So we've covered 3 products here today: pathology management, document, repeat prescriptions, all of our kit, DCBO 129, medical device where appropriate. What we've done is look at areas where we can help you enforce rules and then simultaneously save time. When we first launched these products, it was all around saving time. But what we quickly saw was, by saving time, there's an opportunity to actually enforce rules, which increases safety as well. It's an interesting dynamic whereby if you have a machine automate something for you, yes, it's going to save time, but machines don't make mistakes. So therefore, it can standardize as well. And our team and all of our products sit in that bucket. It will take a day or so for us to get this webinar onto our website, our YouTube channel on our website. As soon as that is done, we will share it with everyone. You should have all had the decks and spreadsheets with example path tests and stuff. Please let us know if you haven't. And if you've got any more questions, let us know. Happy to book a call and take it from there. So thank you for joining. Thanks, Sanj, for helping out.
Thank you.
Thank you. And we're going to end the webinar now. Thank you very much, everyone.